Hi, my name is Dr. Campos from Mexicali Bariatric Center. One of the side effects that we get asked very often after the surgery is about acid reflux. Acid reflux, or GERD, as commonly known, it's the production of acid after the surgery. We have basically, in our experience, around 7 or 8% of our patients on the long run, they can have acid reflux. Acid reflux is the sensation or the heartburn where the acid of the fundus or the stomach increases a little and goes to the esophagus and gives the burning sensation. Could be two kinds or two options about the sensation of acid reflux. And the first one is related to food. And I think it's very important to talk about this because we sometimes have a lot of patients that say, "Doctor, I have acid reflux," or "I have heartburn." And it's very related to food. I'm eating spice, I'm eating drinking a lot of coffee or drinking alcohol. So it's basically related to something that you're doing. So in that case, it's quite simple. You stop drinking coffee or reduce your coffee intake so the reflux will go away. But basically, if we have very good healthy eating habits, if we lose the proper weight during the time that we require to lose all the weight, if we're exercising, if we're not fasting for longer times, basically if you're doing everything that you're supposed to do after weight loss surgery, you don't have that side effect, or you can control the acid reflux very easy. But there's a small percentage, about 3 or 4%, that they can have acid reflux, and we can have two different options. The first one is if you never had acid reflux before your surgery and then you have acid reflux after your surgery, it's a little bit the increase of the production of the acid because of the staple line. In that case, we can go and basically reduce the acid production with anti-acid medication. Right now, we have a lot of over-the-counter dosage like Nexium, Prilosec, Prevacid. So basically, with one single dose a day, you can have very well-controlled acid medication. What we advise is as well that we have the medication to control that. Change your eating habits, have a healthier diet. Don't eat after 7 or 8 o'clock so you're not laying down and having the reflux. Stay away from starchy carbs. Normally starches creates a loosen effect on the diaphragm, so the reflux goes from the stomach to the esophagus. Increase the protein intake. Protein intake closes down the hiatal, and normally you can have a very healthy diet without having problems. The other kind of acid reflux could be because of a hernia. Sometimes during surgery we find a hiatal hernia and we fix it, and that helps you with the acid reflux in the long run. But some cases, around 30% of the cases that they have a hiatal hernia, we cannot fix it because it's not very identifiable during surgery because all the fat that's surrounding the stomach. So sometimes you'll hear or you'll see some cases that say, I have a normal surgery and after I lose my weight, my doctor did an endoscopy and they detect a hernia. What happened? The hernia was there, or my doctor didn't knew that I have a hernia during my surgery. It is basically that the fat that surrounds the stomach, it's basically covering that hernia, so we're not able to dissect or identify the hernia. So when you lose all the weight, you lose all the fat, so your hiatal hernia, it's more identifiable, or we can see it very easy on the endoscopy. In that case, if the acid reflux is very bad and you're not able to control your medication, basically we can have a surgery to repair that. And the surgery to repair acid reflux after a gastric sleeve will be a gastric bypass. In other cases, we can increase the dose of the medication. We can use medication to help the stomach to empty faster. So less acid, more emptiness in the stomach, plus topical medication like Carafate or Mylanta, and plus a healthy diet. Normally 90% of the cases will be controlled with this. But even there's a very small chance that you can have a surgery to correct the acid reflux. And normally that surgery after a gastric sleeve will be the conversion to a gastric bypass.